Universal healthcare. It's something that we are proud of as Canadians, but there are rural and remote communities, especially in northern regions of Canada, where universal healthcare is not to be taken for granted. There are many communities that do not have access to hospitals or urgent care centers and have severely limited access to primary care physicians, where sometimes a physician is present in the community for less than 7 days a month to address the needs of a wait list of 100 people. This is not universal healthcare. There is a shortage of primary care providers in rural and remote communities in Canada, where estimates show that 26 to 82% of the population lacks access to primary care. The need outweighs the supply. In order to address this imbalance, the nurse practitioner, or NP, as primary care provider should be implemented in rural and remote areas of Canada. Research shows that improved access to primary care, which consists of the management of chronic conditions, treatment of common ailments, and overall health promotion, improves health outcomes more than relying on secondary or tertiary services. In the debate that has occurred this week, my opponent has pointed out certain inconsistencies in my position. What my opponent has failed to address, however, is the central issue of the shortage of primary care providers in these underserved communities of Canada. The utilization of NPs, while not fully eliminating the needs for physicians, will allow for patients to be seen as a primary care provider and have the majority of their needs met and managed on an ongoing basis. My opponent did speak to the limitations of the NP scope of practice in BC. While this is accurate, it is not true of all of Canada. Additionally, not all primary care physicians in all settings perform the additional tasks she had listed. Therefore, NPs are an appropriate addition to the rural and remote healthcare teams. NPs, on average, earn $103,000 to $135,000 per year in Canada, while the average family practitioner in Canada earns $250,000 per year. The NP is clearly more cost efficient. While the funding model to employ NPs may be challenging, as highlighted by my opponent, it is not a valid barrier. My colleagues and opponent have pointed out my third argument contains a non sequitur fallacy, and I cede this portion of the argument. However, patient appreciation of the NP role is strongly related to improved job satisfaction, thus leading to increased NP retention. In conclusion, while I believe that my opponent raised some excellent points regarding the limitations and challenges of utilizing NPs as primary care providers in rural and remote areas of Canada, I maintain that there is an urgent need for primary care providers to manage the common ailments and chronic conditions of people in these communities. Nurse practitioners are well suited to provide relief on a strained healthcare system and care for the underserved populations, and therefore should be employed in these settings. Thank you.